there, Pattaya. It's Dr. Ian, and I'm at the Bangkok Hospital, Pattaya, today. With me is my special guest, Dr. Watit, who is one of the senior members in the Ear, Nose and Throat Department. Welcome to the program, Dr. Watit.
Morning.
I'd like to talk to you a little bit about sinus problems. These seem to be something that everybody complains of, but is it something that people get and get over, or is it something that people have for the rest of their lives?
Usually the sinus air are in our body face, but it usually be infected by the bacteria after the chronic virus infection. We can say that after 7 days after the virus infection, the bacteria always superimpose in the sinus of everybody.
Right. So it's not just a simple virus or a simple bacterium, but it is both, you're saying?
Usually by the bacteria superimpose on the virus infection.
Right.
Usually our immunity is enough to stop that, but in some instance we have low immunity and then the bacteria come up.
How do you actually diagnose the condition of sinusitis?
We usually detect the pus from the nasal cavity, from the back sides. That is always come from the sinus in the head.
Right. One thing that you may not understand is the fact that your sinuses are sort of bony cavities inside your skull. You have two up here and two here and one at the back of the nose. Are they all involved, or is it one or two sinuses that are usually involved?
Usually most of the sinuses are involved in the bacteria infection, but mostly it's always on the big one, on the maxillary sinus here.
Right. So what can you do to treat this?
All the bacterial infection in the sinus are treated by the strong antibiotics, and now the antibiotics are very strong enough to cure that problem.
And what about the virus side of it?
For the virus, we have to improve the immunity of the patients, and then after that the immunity can control the virus infection.
I've heard of the sinuscope. Can you tell us a little bit about the sinuscope and what you use it for?
In the past, we cannot detect any abnormality such as the anatomical abnormality or deformity in our nose cavity and sinuses, the ostium, the opening. But now we have the long scope, the very small one, just like smaller than the chopsticks, and then we can introduce the scope into our sinus and detect all the deformity or all the infection, and can do the not only by the detection, but we can do the surgery on with the scope.
So do you actually operate via the sinuscope with direct vision, or are you looking at the screen for the image that the sinuscope would give?
We can do both. In the very narrow operation field, then we can project it in the monitor.
Right. What can people do, finally, to try to avoid getting sinusitis?
In normal people, it's very easy to avoid the sinus problem because your immunity is normal. But in the one who has the allergic reaction or who has the very low immunity by the other disease, just like a diabetes or the heart disease, then you should be aware when you have a cold. You should go to see the doctor if you have a cold more than 7 days with discharging. Otherwise, the sinuses will be infected.
Thank you very much, Dr. Watit. And of course, the recommendation there was if you have a nasal sinus type problem which is going for more than 7 days, go and get it treated. Come along and see us. This is Dr. Ian at the Bangkok Hospital, Pattaya.